शुरू से स्टार्ट करूं? बिल्कुल।
हाँ जी।
ठीक है। Mrs. Asfa, 35 years, received no formal education, married from 10 years, gravida 5, para 4, previous 1, scar with 3 live issues. With her last menstrual period is 15th May 2020, making her expected date of delivery 22nd February 2021. 22nd March 2021, and making her period of gestation 28 plus 6 weeks. She is resident of Shadman, Lahore, and admitted to the services hospital for the workup and evaluation of decreased amount of liquor around her baby and easy fatigability since last 1 month. She conceived spontaneously with a regular menstrual cycle, practicing no contraception. After missing her periods, she assumed to be pregnant, and she confirmed her pregnancy by the urine for pregnancy test, and she visited a local doctor at 1.5 months of gestation, where she was told about the fetus, fetal well-being, and fetal cardiac activity was present. Her blood pressure was checked, which was normal, and certain investigations were also carried out, which was normal according to the patient. There is no history of fever, flu, rash, excessive nausea and vomiting, any abnormal vaginal bleeding and discharge. She perceived fetal movements at the 4.5 month of gestation, and she visited gynecologist at the 5th month, where she was advised anomaly scan, and she underwent anomaly scan. On the anomaly scan, she was told that she has decreased amount of liquor around the baby and some renal abnormality in the baby. She advised hematinics and the calcium supplementation, which she took regularly. There is no history of headache, blurring of vision, heat or cold intolerance, increased thirst, appetite, or increased frequency of urination, joint pain, fever, or any other complaint. She has no history of any pervaginal leaking and pervaginal bleeding. Her blood pressure was also checked, which was normal at that time. She took tetanus toxoid prophylaxis according to the schedule, and she went for antenatal visit regularly. Her second trimester was also unsupervised and supervised and uneventful. But according to the patient, her abdominal growth was not according to the gestational age. But she perceived fetal movements, which are reassuring up till now. She went for the antenatal visit to the doctor at 6.5 months of gestation, where she was again told that she has decreased amount of liquor around the baby, and her blood pressure was normal at that time. And she was referred to the services hospital for the further evaluation and the management. Here in the hospital, her ultrasound was performed, and her certain investigations were also carried out. And on investigations, her hemoglobin was found to be low, that is 7.8 gram per deciliter, and she was advised blood transfusion. And her ultrasound was also performed, and on the scan, and to the patient, doctor also told that she has some renal abnormality, and radiologist told that she has some posterior urethral valve syndrome, according to the patient, I guess. Investigations, her hemoglobin was found to be 8 gram per deciliter, and she was transfused 1 unit of blood with no reaction. Regarding her past obstetrical history, she is gravida 5 para 4, the first female baby, 8 years old, that was delivered by the lower segment cesarean section due to failed induction. No history of any intrapartum, antepartum, or postpartum complication at that time, and baby was breastfed and vaccinated. Her second baby is female baby, 6 years old, that was delivered by normal vaginal delivery at Services Hospital, and that pregnancy was also uneventful. And the third pregnancy, there was male baby that was died at that was stillbirth, and according to the patient, she was advised 1 unit of blood transfusion at that time due to decreased hemoglobin. And after the blood transfusion, the baby was died. But she was not evaluated at the 6-week postpartum for any blood pressure, high blood pressure, or blood sugar levels. Her fourth baby is female baby, that is 2 years old, and she was delivered by normal vaginal delivery. She is alive and healthy baby, no intrapartum, antepartum, or postpartum complication, and now she conceived after her lactational amenorrhea of 2 years. Regarding her gynecological history, she menarche at the age of 13 years with regular menstrual cycle, and she has no complaint of intermenstrual bleeding, postcoital bleeding, and the couple never practiced any method of contraception, and her pap smear was never taken. She has no history of chronic hypertension, diabetes, asthma, renal problem, or history of any tuberculosis or contact with a tuberculous person in herself and in her family. And there is no history of anomalous fetus previously in herself and in her family, and no history of previously growth restricted babies, or or the birth weight of all the babies were normal, according to the patient. And the baby that was died, according to the patient, that was well formed with no obvious gross anomaly, but there was no postpartum mortem examination was done by the hospital. And patient was also not evaluated for any disease. Drug history is not significant, and she is non-smoker, non-addict, with normal sleep, bowel, and the bladder habits. Her diet is not deficient in the meat, egg, and the milk products, and she is not in the habit of any pica intake. Her husband is laborer by profession, and necessities of life met with great difficulty. She is satisfied with her life. Regarding her general physical examination, a young lady sitting comfortably on bed, well oriented in time, place, and person, with a body mass index of 25 kilogram per meter square, and on investigation. And her blood pressure is, regarding her vitals, blood pressure is 120 by 80 millimeter of mercury, pulse 80 beats, pulse rate is 80 per minute regular, and temperature 98 Fahrenheit, respiratory rate is 17 per minute, palate positive. There is no history of any jaundice, no jaundice, thyroid is not enlarged, and all the accessible lymph nodes are negative. No sacral and peritibial edema found. Regarding her chest examination, normal vesicular breathing with first and second heart sounds are audible, no added sound, and bilateral breasts are symmetrical with no mass or lump palpable. On her per-abdominal examination, on inspection, abdomen is protuberant with central inverted umbilicus, and a lower segment Caesarean section scar is found in the lower abdomen. No prominent vein, stria, or the stria. And on palpation, abdomen is non-tender. Symphysiofundal height is 28 centimeter with brief presentation. Back is on the right side with fetal heart sounds are present. And on palpation, Liker volume seems to be adequate, but according to the patient, Liker is absent on the scan. That was all about.
Investigations.
On investigation, I need complete blood count with the iris flip.
Hemoglobin 10 gram per deciliter.
Okay, 10 gram per deciliter. I need red blood cell indices, means cell volume, mean cell hemoglobin, and mean cell hemoglobin concentration. Okay. I need urine complete examination for the pus cells, microscopy, and red blood cells.
Normal urine complete examination.
Random blood sugar, time random blood sugar.
What do you mean by time random?
This time, till date random blood sugar of date, this date. All investigations till date. Hepatitis B surface antigen and anti-HCV antibodies.
Negative.
Okay. Dating scan.
What you need on dating scan?
I need fetal cardiac activity and fetal at that time, and placenta, and any adnexal pathology. Any adnexal
Dating scan is
pathology or
corresponding to gestation.
anomaly scan. Anomaly scan for the fourth chambered cardiac view.
On anomaly scan, fourth chamber cardiac view is normal.
Any other abnormalities?
Bilateral polycystic kidneys and AFI6.
Okay. And recent scan.
Recent scan we'll discuss later.
Okay.
Any other investigation you want?
Carrier keeping
क्या?
और
क्या चाहिए?
मैडम बस यही चाहिए.
Okay. Summarize.
Research. 35 years, gravida 5, para 4, previous one, scar with 3 live issues at 28 plus 6 week of gestation with oligohydroamnios and renal agenesis with the hemoglobin 8 gram per deciliter and symphysiofundal height 28 centimeter. Breech back is on the right side with the fetal heart rate 140 per minute.
How you come to know that your patient has renal agenesis?
Patient was telling, and after patient was telling that since her anomaly scan, 20-week of gestation, she was told that she has decreased amount of liquor and there is some abnormality in the kidneys of the baby. But at 26, but she do not allow any other. After she again visited the gynecologist, and at 28 week of
What is difference
patient.
between renal abnormality and renal agenesis?
Sorry, renal abnormality, I must say, not renal agenesis.
What are the meanings of renal agenesis?
Renal agenesis means by complete absence of renal kidney, renal tract.
Yes.
So, I must say renal abnormality, not agenesis.
Okay. How will you manage her?